This is Loren. It has been precisely 3 months since she began living alone in her new apartment. She has adapted well to solitary life, a creature of habit, perfectly in tune with her environment. Everything has been going splendidly until today.
I'm fine. This is fine.
She was, in fact, not fine. A collision with the territorial bedpost has left her with a sprained foot. She has long been at odds with this apex predator in the apartment ecosystem, but it seemed like she didn't expect it to strike today. Alas, living alone means no one's around to say, "Sit down, I'll get the ice." So, she must once more adapt and become the nurse. Luckily, she knew exactly what to do.
Huh?
Oh, you stupid girl, you forgot, didn't you? First you go and walk with your phone in your face, then... Never mind. Let me remind you then. Use the rice method. Yes. First, she must remember to rest the injured area to allow time for it to heal. Yes, that's right. Get it in a neutral position first. Then, ice the injury for 20 minutes. No more than that. Wrap the ice pack in a thin cloth first. Never put it directly on your skin. Afterwards, compress the area with an elastic bandage. Start near the toes, then slowly make your way up by making a figure 8. Make sure to cover everything until the bandage runs out. Then, carefully lock it in place. Finally, elevate the injured area by keeping it raised on a pillow. Yes, like that, above your heart level. This helps keep the swelling down. And she is back to doom scrolling on her phone. Meanwhile, the bedpost remains unmoved. Its silent reign of terror will undoubtedly continue. But for this unbothered queen, it seemed like this was not a crisis, but rather an excuse to lay down in bed all day.
POV. You're having the best day ever until this happens. Yup, that's an abrasion. Not too deep, but it can still cause pain and infection if ignored. So, what do? Simple. Let's fix that the right way. But first, what is an abrasion? Abrasion happens when your outer skin layer, the epidermis, gets rubbed off. You'll see redness, maybe a little bleeding, but it's mostly surface damage. So, what do we do when this happens? Step 1. Clean hands, clean care. Wash your hands or wear gloves. Germs are not invited. Step 2. Stop the bleeding. If it's bleeding, apply gentle pressure with a clean cloth or sterile gauze. Next, rinse it with clean running water. Remove dirt and debris carefully. Now, apply an antiseptic ointment. This helps prevent infection and keeps the wound moist. Cover the wound with a sterile bandage. This keeps it safe from dust, dirt, and bacteria party crashers. change the bandage daily or when it gets dirty. And that's how you treat an abrasion. Now, let's explore the different types of abrasions and other important things we need to know about this common injury. Abrasions come in different types, depending on how deep or how they were caused. The first type is superficial abrasion. It's a light scrape that only affects the top layer of skin. The deep abrasion reaches into the dermis, which is the second layer of the skin. It may bleed more and take longer to heal. The third type is the gravel rash, also known as a brush burn. This usually happens when someone slides or falls on rough ground. The last one is the patterned abrasion. This occurs when an object leaves a mark or a design on the skin, like the pattern of a tire or a sports net. The body begins healing an abrasion almost immediately. Within a day or two, white blood cells protect the wound from germs while new skin starts to form underneath. Sometimes, abrasions need professional help. If the wound is large, dirty, infected, or bleeding heavily, it's time to see a doctor. Always be prepared and practice safety in everything you do.
This is Rochelle, an 18-year-old freshie who has no idea how to properly cut a garlic. Ouch! Good thing Rochelle has an idea on how to properly do a first aid on a laceration. First, clean with water. Put an antiseptic ointment on the cut. Then wrap a gauze around the wound to protect the area. Another thing about Rochelle is she loves dressing up with shoes, especially the ones that hurts her feet. First, clean it with water. Then put an ointment on the blister to disinfect it. Lastly, to protect the blister, put the gauze around it.
So this is Lai. All day, all she does is study and study. And while you guessed it, study again. As more time passed, she realizes it's enough for the day and took a rest. Until she stumbled upon this. Falling forward, she accidentally used her hand as a support, leading to a wrist fracture. So what do we do in the case of a wrist fracture? The first thing I did, as we can all see, was to protect it and hurriedly went home. The next thing to do is let the injured part rest. Afterwards, wrap an ice in a cloth and put it in the injured area. Should there be an absence of a bandage, you can use a cloth, stretchable cloth, for self-bandaging to minimize the movement of your wrist, preventing further injury or worsening of it. And make sure to elevate it afterwards. In cases like this, such as a fracture, it would be better to seek immediate help to ensure that proper care is given to the injury.
Hello? Hi? Hello? Hi? Hello? Hi, this is Ivan. We all know him as the Grammar. the tired UPLB student, the doom scroller, and especially the coffee addict. But Ivan has a little secret. He's actually a first aider. Got a drunk dad who suddenly tripped and sprained his shoulder? Fear not, Ivan's got you covered. He's here to show you how to wrap a triangular bandage like a pro. No panic, no drama, just quick, easy first aid that even your dad would be proud of. Once he sobers up. Step 1. Prepare and fold the triangular bandage using the cravat method. Step 2. Place the bandage over the shoulder, making sure the lower end is longer than the upper end. This gives better coverage and support. Step 3. Wrap the longer end around the armpit of the injured side. Step 4. Bring it across the chest until both ends meets at the back. For step 5, secure it with a square knot at the back, using the right-left, left-right method, firm enough to hold but not too tight to cut off circulation. Step 6. Tuck and secure any loose parts for a clean finish. Lastly, check if everything feels comfortable and supportive. And that's it. Shoulder supported, first aid mission accomplished. If you want more videos like this, please subscribe and press the bell button. Thank you and goodbye.